Thank you so much, Dr. Dotson, for joining us today for another episode of Black Surgeons. We're privileged to have you here. Dr. Dotson is currently doing his fellowship down in California. He's going to be concentrating mainly in cornea surgery, but I'm no ophthalmologist, so I'm going to let him tell us a little bit about who he is. Tell us a little bit of what he does. Dr. Dotson, thank you so much for being here.
Yeah, thank you so much for having me. So, my name is Dr. Aaron Douglas Dotson. I am born and raised from Los Angeles, California, from the Inglewood area. I did college at UT Dallas, where I studied neuroscience and classical piano, medical school at St. Louis University. It's been a long journey. 4 years of residency at the University of Iowa, which is one of the world's best ophthalmology residency programs. And I'm currently doing my fellowship in cornea, external disease, laser refractive surgery. Basically, everything in the front part of the eye is my territory. And I'm based in San Francisco right now at UC San Francisco. I love ophthalmology. It is the best field imaginable. If I had the opportunity, I want to recruit everyone in the ophthalmology. But I'm very excited to be here this evening and to share more about my experiences in medicine and being a Black surgeon.
I wish I met you when I was back in medical school. Maybe I would have also chosen ophthalmology. You're too enthusiastic about the eyeball, so I love it. So, just kind of to start out, can you tell us a little bit more about where you grew up? You mentioned in Inglewood. Can you tell us about your childhood, your parents, and your upbringing a little bit, and how that was like, and how that kind of shaped you to become a person that you are today?
Yeah, so I'm actually back home in Inglewood right now for the Christmas holiday, so it's always fun to come back and to see friends and family. But Inglewood has changed tremendously over the years because we now have the brand new, like the Ram Stadium. We have so much development throughout the city. Some may call it gentrification, but when I was a lot younger, Inglewood wasn't the greatest place in the world. It kind of struggled a bit when it came to gang violence as well as addiction that was very visible on the streets. So growing up and being around that in the vicinity right outside my front door, I knew that I wanted a bit better for myself, but I also wanted to choose a career where I could help out my community and others who were underserved and disadvantaged. I was very blessed to grow up in a two-parent household, my mom and my dad. However, none of them were doctors. I am the only doctor in my family. I am the only surgeon in my entire extended family. And yeah, I felt like I had the encouragement and the support from everyone else who was around me, but it was challenging being the only one in the family to go down this career path. But I had a lot of very good mentors along the way who took me under their wing and really showed me the way of what it meant to become a good physician and surgeon.
I feel like it's such a common thing for people of color to be the only ones to do things. You mentioning that you're the only one who's a physician, you're the only one who's, a surgeon. It's a lot of people that I've talked to, including myself. It's like there's a certain amount of like until you like high school, maybe there's some people who, your parents or somebody who has been through that undergrad and they're supporting you. They are kind of knowing exactly what to tell you sometimes when it comes to those areas. But at some point, when you start going into medical school or residency, it's like you start feeling very different from essentially people who are around you because they have no idea what you're going through, which is a very interesting experience, I would say. But that's very interesting to see. So tell us a little bit more as you growing up.
High school. It was a great experience for me, but it also was very challenging. I went to a very academically heavy high school, and I felt like being around other incredibly smart, motivated, talented academic individuals and leaders really motivated me to want to up my own game. So within high school, I studied tremendously hard. I was also heavily involved within the arts. So outside of medicine, I'm a musician. I play classical piano. I used to play seven instruments, different instruments at once.
Wow.
And I felt like it really was the arts that helped to ground me within all the craziness of stuff that was going on. But for college, I knew that I wanted to study the brain, being neuroscience. Kind of like what I mentioned, how there was so much kind of bad stuff around within my community. I really wanted to learn how the brain worked, how the brain functioned, how I could learn how to fix a lot of the problems within my community. So I knew I wanted to study neuroscience. Believe it or not, I wanted to get out of California. I didn't care for it growing up. So I didn't apply to any colleges in the entire state. And I knew that I had a lot of family in Dallas, and I found the University of Texas at Dallas, and they had an entire school devoted towards behavioral and brain sciences. I'm like, okay, light bulb, this must be where I should go. So I get into UT Dallas. I had a very good scholarship, and I loved it. They really showed me inside and out what it means to be an academic individual, what it means to prepare you for life outside of college, prepare me for medical school, everything. It was an incredible 4 years. It is one of the best colleges in all the state of Texas. And yeah, I would do it all over again.
Nice. That's amazing. Any major struggles during college? You feel like you kind of got in and you kind of knew what you wanted to do and you just kind of aced your way through, or were there any major lessons that you learned through
Oh,
that?
man, there were definitely some lessons. So, I nearly quit altogether. Um, I knew that I wanted to become a physician ever since I was a kid. My mother's physician was Dr. Stuart L. Gilbert. He was the first Black man in a white coat I had ever met. He was her internal medicine physician. He was a leader in the community as well as a minister. And I shadowed with him a lot when I was growing up. So I knew that I wanted to become a doctor. But when I got into college, and I'm around all these other very smart people, I was like, okay, y'all are kind of crazy. Because, I mean, everyone's like studying hours on end, and they're like, oh, I pulled this many all-nighters for this test. Oh, man, like I got 110% this and that. And it got to the point where I was like, maybe I'm not cut out for this. And I was going to change everything over to pharmacy.
Wow.
Believe it or not. So it was a random day in college. I was getting ready to. I was just so defeated. I mean, I was doing well in my classes, but I was like, I don't want to be this stressed out forever. Like, I have to do something else. So as I'm walking on over to the academic advisor's office, I see my friend Lauren. I still talk to her to this day. She was an ambassador for the Summer Medical and Dental Education Program, or what's known as SHPEP now. She pulls me aside. She's like, "Hey, Aaron, like, have you heard of SNDEP? You should consider applying." So it was within a week of the application being due. And I'm like, okay, well, I have nothing to lose. Like, sure. So I did not make it to the academic advisor's office to change my major because they had closed, because Lauren and I were just catching up on life. I submit my application to SNDEP, and I was accepted. So I did SNDP at Yale back in 2013. And from then on forward, I was like, okay, being a physician really is my calling, because I can't explain how these things in life just line themselves up each time I try to steer away.
Yeah. Yeah.
Um, but, college, it was an amazing 4 years. I did a lot of leadership. I was a part of the Black Student Alliance. I even created the Minority Association of Pre-Medical Students chapter, the MAPS chapter, even after I graduated, when I spent a gap year. I did research dealing with mice and rats, where I got to do neurosurgery. That's how I knew I wanted to become a surgeon. So those 4 years in college, they meant so much to me.
That's amazing, man. It sounded like you were trying to get away, but something was like, nope, you can't. This is.
I thought, like, there like one other really quick story I'll tell you is that it was one day where I had two tests. I had two tests in one day, biochemistry and physics. And I had only studied really for biochemistry, because biochem at UT Dallas was a nightmare. It was absolutely so challenging, so hard. So, I mean, I am a man of faith. I will admit I'm a man of faith, but it's like that night before the test, I was like, oh, dear Lord, like, if being a physician is what you want me to do, I need you to give me a sign, because I'm like, I don't know if I want to make it. So the next day comes, and it's like, I take my biochemistry examination, and just the whole room, it was like a cloud of just struggle came over us. We're just like, dang, that was hard. And I'm like, no, I felt like I did bad. And now I have to go take this other test that I didn't study for. And I get to physics. The professor passes out all the examinations. Before he says, okay, turn over your exams. The entire university had a blackout. Entire university. I have to this day, I have no clue what happened, why it was not me, I promise. But in that moment, I looked up to, I was like, okay, we're not going to have any more arguments. This is what you want me to do. And yeah,
Wow.
life happens. Things happen for a reason.
That is amazing. So making it through college sounds like you have been passionate about, just kind of reaching back, mentoring people, and just kind of starting things that really impact your community. Now you're heading over to medical school. How was that application process and the kind of interview process, and how did you land to the medical school that you ended up?
Yeah, so applying to medical school, it was challenging because, like I mentioned, no one in my family is a doctor. So I was very blessed to have a few mentors ahead of me through the Black Student Alliance who were actively applying to medical school a few years before me. So they gave me a lot of advice for this is what you need to do to study for the MCAT. This is the advisor you need to go to. These are the schools that you need to apply for. And I felt like without that exposure and without that mentorship, like I don't know if I would have made it. But I applied all over the country. I interviewed all over. I interviewed at not too many places because my MCAT score was not the best in the world. I took the old MCAT and I had to take it twice. And on the second time I took it, my score only improved by maybe like 1 or 2 points. So I didn't even know if I was going to make it. But I was very fortunate to have been accepted at St. Louis University School of Medicine. I have a lot of family in the St. Louis area. My mom is originally from Northeast Arkansas. A lot of her sisters live in St. Louis. So it was really a perfect fit for me. Those 4 years, they were very difficult, very challenging, but some of the most influential and positive things that I could say in my life. I met lifelong friends that I still keep up with to this day. And I really feel like SLU prepared me for residency, prepared me for life, and just where I am today, even as a fellow.
But how did you come to ophthalmology? At what point were you like, the eyeball is what I want to do?
So as I mentioned, when I was in college, I did neurosurgery on mice and rats. I learned it, I did it, and I taught it to other students that were coming into the lab. So I came into medical school thinking like, okay, I'm gonna do neurosurgery. I'm gonna be the next Dr. Keith Black, who is a very prominent neurosurgeon out here in Los Angeles. I'm like, okay, like we're gonna make this happen. I get to the OR for neurosurgery, and I'm just like, okay, this is cool, but everyone seems so burnt out. Everyone seems so overworked. And I'm talking to the residents. They're like, yeah, man, like I've been on call for this many hours and I haven't slept, I haven't eaten. I'm just like, I want a life outside of medicine. So I stepped away from neurosurgery, and I was the type of medical student that just kept an open mind to everything. And I loved bits and pieces of every part of medicine, but I couldn't find something that combined it all until I got to ophthalmology. We had like our career explorations where it's like a list of things you can shadow for like 2 weeks. And I look at the list and I'm just like, okay, I've done everything but ophthalmology. I thought that the eyes were very complicated when I was in college, but I'm just like, well, why not? Let's give it a shot. Day one, the light bulb went off and I'm like, wait a minute. So ophthalmology, we work Monday through Friday. We work regular hours. Yeah, we have call. Everybody has call, whatever. But all the ophthalmologists I worked with, they were very happy. And I considered them to be very much so primary care physicians who also do high volume, high yield surgery. Everyone on the planet, I mean, depending on where you are, if you live to be old enough, you are going to see an ophthalmologist because cataracts. Everyone's going to get cataracts eventually. I love the surgery. I love the clinics. I love not needing a stethoscope. I love using my hands for everything, just like piano. And from there on out, that's where I was like, okay, forget everything else. This is what I want to do because this is perfect for me.
Nice. That's amazing. How has your other talents, so you talked about playing all these instruments, how has that influenced you towards surgery? You talked about being neurosurgery being one of your interests, but as far as like ophthalmology, you talked about a little bit of a piano. Like, how has that kind of influenced your decision making and even your skills probably.
Yeah, I feel like music definitely influenced me to want to do something a bit more hands-on where I can utilize my hands and skills to help change lives. I please don't cancel me for this world. But what I can say, I feel like in medicine, almost any of us, we can learn a pathway. Almost any, we can learn how to understand pathophysiology to some extent. I mean, it's like the Krebs cycle. Like I can learn it, but I mean, yeah, I'm probably gonna forget it. I mean,
Everybody
but
will.
when it comes exactly. When it comes to surgery, I felt like it was a craft that you have to work on and that you have to perfect. There are definitely people who are out there who are just like, just gifted in general, but all of us who are surgeons, we have to start from somewhere. And there's just something, it's like that added like pressure and that added skill set that really drew me into surgery. But, with music, I still love music to this day. I still play piano whenever I can. I'm just now getting back into like music production, so I'm trying to create my own music. And basically, when I'm in the operating room, I'm very big on music. I play. I have very. I we it's a vibe when I'm operating.
What's your playlist so I can go follow it? And
Oh man. So I listen to a lot of K
mm,
Tronada, love K Tronada, Maji Jordan, love them. Kind of like, smooth, a lot of R&B vibes, a lot of smooth vibes and stuff. But a lot of times my nurses, they're just like, wait, Dr. Dotson, let me. Yeah,
that's amazing. Usually, when I'm in the OR, man, I'm just like whatever the nurses want. You got to keep everybody happy and be like, "What do you guys want to listen to?"
that's true.
I'll go with it. Um,
That's also true.
but just a little bit, I want to switch gears. As we're trying to highlight on Black surgeon, the Black experience. As far as us being Black surgeons, how has your identity shaped your experiences in medicine and surgery? And what kind of challenges have you faced as you're embarking on this journey, not through medical school, through residency, now a fellow, just because of how you look like? Can you kind of talk a little bit about that?
Yeah, it has not been easy, but I think that it's an experience that has made me into a better physician and a better surgeon. There are a lot of highs and there are some lows. Some of the highs would be, when I walk into a room and I have patients that look like me and we see each other and it's almost like that sigh of relief, like, okay, I am in good hands. That is something that you have to experience it yourself. And it's something that means the world to me because it's a reminder of like, this is why I chose to go into medicine and to become a surgeon so that I can help underserved, disadvantaged populations and others who also look like me. Some of the challenges I would say are, I have experienced prejudice as well as racism within medicine. In medical school, it's a short story. Medical school, I was going up to the anatomy lab, and I wrote this in my personal statements. I'm going up to the anatomy lab. I'm in scrubs. I have the big old anatomy netter's textbook in my hand, and I have a backpack on with the badge that says medical students. I'm going up with this white lady. She happened to be an orthopedic surgery resident, and she was teaching our class. And she looks at me up and down. She's like, "Oh, are you the janitor here to clean the anatomy lab?" And it took
Wow.
the all of the ancestors to hold me back from just saying what I really felt like. But I was like, no, I'm actually a first year medical student going to the anatomy lab. I hear we have a guest lecturer coming in. And she just looked like a deer in headlights the entire elevator ride up. I fired back every single question and answer with her. At the end, she was like, "Oh my gosh, Aaron, I'm so sorry. I'm mistaken you. You can come to my OR anytime." But those experiences, they don't leave you, but they don't disappear altogether. I have some patients who they'll try to like size me up because they know that like I'm Black, where it's like, where's you go to medical school? Where's you go to residency at? And it's there are a lot of surgeries that I do where the patients, like I mean, of course, like I'm working in attending clinics. The attendings are the attendings, but it's like they're praising them, da 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 da. Da. Then like they don't want to pay me any mind when it's. But what I tell myself is that as an attending physician in just the next upcoming months, I will not put up with any disrespect whatsoever. And if I have anyone who is spicy or who does not want me as their physician or surgeon, then guess what? I have no problem of sending you to somebody else. That's one less note that I have to write, and that's one less headache that I have to worry about. But I treat everybody. I feel like growing up in Inglewood and doing residency and traveling all over the country and the world, I'm cool with everybody. I can interact with anyone, I can talk with anyone, and I just want to be the best physician and surgeon possible and to show people that I care. That's what's important to
Yeah,
me.
yeah. Do you want to end up in Inglewood, or why are you thinking about practicing after fellowship?
Yeah, so I'm actually in the process right now of interviewing for jobs across the country. I've made the decision that I want to stay in academics. I love teaching. I love education. Like that is where my passion really does come out when I'm working with the junior residents and teaching them how to suture, being on call with them. So I'm not sure exactly where yet, but probably within a larger city with a large urban population. A few places I would have the opportunity to work at the county hospitals, which is I work at a county hospital now. And I mean, that is a patient population that is near and dear to my heart, and I will always ride for them. But, regardless of where I end up in the future, as long as I am happy, as long as I am teaching and doing as much surgery as possible, that's what I want to do.
Nice. So if we have certain medical students who are interested on, going into medicine, potentially become an ophthalmologist, what advice would you have for them?
Yeah, it medicine, it is a long road and it is a lifelong journey, but I would not change it for the world for me personally. Not everyone can say that. However, I will admit a lot of ophthalmologists, we are very happy. And when you look at those surveys, would you choose your specialty again? 9 times out of 10, we're going to say yes. Um, if you are interested in medicine, I would say reach out to anyone who is remotely in your life and ask them what is their day to day life. Ask them what they like, what they do not like. Don't just try to reach out to doctors. You should be talking to nurses, talk to physician assistants, talk to dentists, talk to radiology technicians, anyone within the healthcare field, just to get an idea of like, okay, could I see myself doing this? Try to shadow if possible. If you do not have a primary care physician, reach out to your parents' PCP like I did. Reach out to your aunts, uncles, cousins, anyone who would have the opportunity to talk with you. Because there are not a lot of Black individuals in medicine, we are more willing to talk with others of color who are trying to go in the field. I've mentored at this point over 100 students throughout my time to this day. And that's what I love doing because people like Dr. Gilbert, they did the same thing for me. So it is my duty to do the same thing for them. If you're interested in ophthalmology, you have to get involved with the National Medical Association or the NMA. NMA is the graduate version of the Student National Medical Association, and it's broken up into the different subspecialties. I'm a part of the ophthalmology section. We have the Rab Venable Research Program, which is done every single year. It's all expenses paid to present your research for the top leaders, the top minority leaders in ophthalmology around the country. The American Academy of Ophthalmology also has the Minority Ophthalmology Mentorship Program, which is an amazing opportunity with amazing resources. So there's a lot that's out there. It's just a matter of finding those resources. And my job is always to help connect people with those resources if that's what they want to do.
Nice. And so, you know, how do you think we can improve access though? As you're talking about trying to find somebody who is in their community, um, but as you know, the percentage of, Black surgeons is not that great out there. A lot of us I feel like looking at the data, tend to go to some of the more primary care specialties. Looking at the data, for example, ophthalmology, tiny percentage. My field, ENT, very small percentage. But we know that there's a lot of needs out there, especially in ophthalmology. I mean, it's crazy, and we need representation. And so, what do you think? How can we improve access and representation for underrepresented groups in these specialties?
I think that the best way to improve it, honestly, is representation. And it simply is seeing others who are in the field who look like you. Because just like how I had Dr. Gilbert in my life, if he was not there, I don't think that I would have become a physician. So what I do is I'm fairly active on social media. I love talking about ophthalmology and just how cool and amazing it is because it genuinely is. And I've had many people who reach out to me just a direct message like, "Hey Aaron, like my friend referred me to you because you're the eye guy. I want to learn more about ophthalmology. Can you read through my personal statement? Can you help me to edit this or edit that?" And I'm always going to say yes. I mean, I may be very busy. It might take me a little bit to get to people, but I almost always am going to say yes. I feel like it's those types of experiences that are really going to help move the needle. When I matched into residency, there were less than 20 Black individuals who matched out of more than 400 spots in the entire country. And because of multiple efforts like social media, Rap Venable, the NMA, the Mom program, we are doubling, tripling our numbers in ophthalmology. There are fewer than 2.5% of Black practicing ophthalmologists in the entire United States right now. And a lot of them are retiring in age. So they're looking to replenish that. So it feels great to be a part of this wave and to be someone who's helping to shuffle in more people into this field. And I mean, I look forward to doing that for my entire life. But I feel like just representation, that's what matters the most.
Amazing. I feel like I see a program director in you already, man.
Honestly, yeah. I mean, I've gotten that a bit, and I mean, I would love to be a residency program director. So
Yeah, that's amazing. That the passion you have for, I can just see it exuding in you, and so that's good to have because we need more people on that table. Like if you don't have it, like I mean, I'm sure you've been through all the residency interviews and like seeing people through the matching process, and if there's nobody on that table representing you, you might have messed up one little thing and you're done. Rank just goes like all the way down. And so, but if you have people who potentially look like you or will vouch for you, so it's amazing that we have people like you going into academia. So I'm praying for you, my guy. We need you out there, and I would love to see one day you're a program director, and I'll just hit you up and be like, see, I manifested it.
yeah, thank you.
But I don't want to take too much of your time. I just wanted to finish with a couple questions. One, so far in your career, what's been the most rewarding moment or moments of your career so far as you're pursuing ophthalmology and now your fellowship?
Yeah, I would say one of the most rewarding moments is being a part of the organization I'm in, which is Black Men in White Coats. Organized, founded in the early 20s because there were fewer Black men going into medicine then compared to like the 1960s. Big problem. So now, the numbers have definitely changed, but I've been able to be on the NBC Today show as well as within Forbes to share with the world the good about the organization, which it's all been doing. But I would say even more special to me are my mentees. Like as I mentioned, I do a lot of phone calls. I speak to a lot of different student organizations via Zoom. I do practice interviews with my mentees. I go through personal statements and I don't charge them. The only thing that I want as payment is for you to text and to call me to be like, Aaron, I matched at this program. I got accepted at this summer program. Thank you. Like that, that's what means the world to me. I have two mentees who are very important in my life. I met them at SNMA, at AMEC, like back in 2019 in Philadelphia. We were doing like speed mentee mentorship interviews. I met five students. I gave them all five like my contact information. Two of them kept up with me. Those two individuals right now, this was when they were pre-med in college.
Wow.
Those two individuals, one of them, I mean, both of them had full ride scholarships to medical school. One of them is already in ophthalmology residency at the University of Chicago. The other one is, getting ready to match in a few months into ophthalmology residency. Like those are the things that there's no amount of money in the world that can give me that same type of feeling and gratitude. So
That is amazing. Like literally you pouring into them and now they're following the same path. I can attest to that as far as like my mentors too. It's so powerful. I was talking to somebody else and we are talking about how powerful it is to just have mentors. Like, I feel like early on in like high school and early college, I didn't really think about that. But as I was moving up, I was like, man, like, why did I waste so much time trying to figure things out on my own when there's already people who would have really just vouch for me and show me the steps, and so it's so important. The reason why I went to ENT is one of my mentors, really, to be honest. I was like, I didn't know anything about ENT, and I found this guy. His name is Dr. Moore, and he's like super charismatic, black dude, like loves the community. I was like, man, that's kind of what I want to do. I was like, I want to do some kind of surgery, but like he's doing that,
Yeah.
let me check it out. And I was like, found this field that I didn't even know about, and I loved it. And so, um, just to emphasize the importance of mentorship and the fact that we all love doing it, because it's like somebody else also did it for us, and so we're paying forward, and that's one of the most rewarding thing you can ever think of. So, Dr. Dotson, I appreciate your time. Thank you so much. I'm gonna keep up and seeing how your journey is going. Keep us updated on how you're doing and where you're gonna end up. If anybody wanted to contact you, are you willing to give your social media? I'm happy to share it, but how can they reach to you and for mentorship or anything?
Absolutely. So you can reach out to me on Instagram. My handle is at Dr. DMD. That's at Dr. period D period MD. Or you can find me on LinkedIn as well. You can search my name, Aaron Dotson. If you reach out to me, if you're interested in medicine, ophthalmology, let's set up a time to chat. Let's talk more about it, and let's help change the world.
Love it. I don't think we can finish in any better way. Hey guys, so thank you so much for watching another episode of the Black Surgeons podcast. If you haven't already, please subscribe to get more material like this. And also, by you subscribing, it helps spread the word and for more people to view this channel. Again, we appreciate you guys, and we'll see you on the next podcast.